Thank you very much, and good afternoon. Thank you for the podium. And over the next 10 minutes or so, I'm going to talk about actually the application of acupuncture in colorectal practice. So I have no disclosure. Now, to begin, I would like to give you a little tutorial on traditional Chinese medicine. Now, according to Chinese medicine theory, the body is like a universe, and there are two opposing forces, the yin and the yang. Now, the two forces usually are in balance. So when the two forces are in balance, your body is healthy. And in your body, there is energy we call qi, okay, that flows along specific pathways we call meridians. The constant flow of energy along these pathways will keep the yin and yang in balance, so you'll be healthy. But if there's a blockade to the flow, you will have disease. So very simple. Now, acupuncture is actually the application, a technique of insertion and manipulations of fine needles in acupoints to achieve therapeutic purposes. Now, anatomically, acupoints are actually areas on the skin with low electric resistance, and also there are closer nerve endings. Now, what is the underlying mechanism? How does it work? Now, according to Chinese medicine theory, acupuncture actually can promote the circulation of qi, or the energy, and restores a balance of yin and yang, and that can achieve a therapeutic effect. But in the Western world, actually, a lot of research has been done, and it shows that various theories have actually been proposed to explain how acupuncture works, and that include neurohumoral and also gate control theories. Now, electroacupuncture is actually the combination of electric stimulation and also acupuncture. By applying electric stimulation of various frequencies like low frequencies and high frequency, it will stimulate the central nervous system to produce different types of endogenous opioids like, enkephalins and dynorphins, and that work as an energism to produce analgesic effect. And also, if it's a low-frequency stimulation to the needles, it usually acts at a hypothalamus level, whereas if you offer high-frequency stimulation, it will work at the brainstem level, and the two will merge together, and there's a final common pathway around the periaqueductal gray, which is the main pain control center, and that will send descending inhibition signal to control the pain. Now, clinically, we have applied acupuncture to patients with undergoing colonoscopy as an analgesia. And also, we have applied acupuncture to enhance postoperative recovery after laparoscopic colorectal surgery by its pain relief effect, because it can also enhance GI recovery and also shorten hospital stay. Now, first about colonoscopy, right? Now, colonoscopy is a painful procedure because of the visceral pain. It's not the acute somatic pain, but it's a visceral pain, and that is related to stretching of the mesenteric attachments and also pressure of air distension on the colonic wall. Now, before we apply acupuncture to patients with, undergoing colonoscopy, we have actually conducted a pilot study using an electronic barostat, which is a neurogastroenterology research device, and that can produce phasic isobaric rectal distension. And we use this device to standardize the pain stimulus to each patient and to try to use it to mimic the visceral pain caused by gaseous distension during colonoscopy. And hopefully we can actually use this to evaluate the efficacy and also the mechanism associated with pain reduction, visceral pain reduction during colonoscopy. So this is the study design. So we enrolled altogether a group of cohort patients after bowel preparation, and the intervention group will undergo electroacupuncture of 45 minutes, and the acupoints used are listed here. So they are, according to Chinese medicine theory, these acupoints are relevant to the treatment of abdominal pain. And the other group, the control group, were randomized to sham acupuncture. So after 45 minutes of acupuncture, these patients will undergo a phasic isobaric rectal distension using this electronic barostat device. And we'll measure the primary outcome of this study is looking at the pain threshold, the pain scores, and also at different time points, we try to measure the blood of the patient for beta endorphin level. So regarding sham acupuncture, we're actually using shorter blunt tip needles that were placed actually without skin penetration, so they're non-penetrating, 20 millimeters away from the acupoints. And you know this is electric stimulation for the true acupuncture, but for sham acupuncture, we apply pseudo-stimulation, and which means we're connecting the needle to incorrect output socket of the electroacupuncture device. So all these patients are actually acupuncture naive, so they will not be able to tell whether this is a true or sham acupuncture. Now, regarding the results, what we found was that patients receiving electroacupuncture, actually they have a higher pain threshold and also lower pain scores when compared to those who receive sham acupuncture. And these lower pain scores were actually associated with a higher beta endorphin levels at all the different time points measured. So following this pilot study, we conducted another randomized control study now using real colonoscopy. Very similar study design. We enrolled a patient and then randomized them to 45 minutes of electroacupuncture, or the control group of sham acupuncture. And after that, we subject the patient to real colonoscopy, and we continue the electroacupuncture or sham acupuncture during the procedure. And then, for the study, we actually make use of the patient-controlled analgesia, using propofol in order to quantify the amount of analgesia consumed. And the primary outcome of this study is actually the amount of patient-controlled sedation that was consumed by the patient. Though this is a patient trial flow diagram, altogether we have randomized 64 patients in the electroacupuncture group and 64 patients in the sham acupuncture group. So this is the main outcome measure, very busy slide, but what we found was that the total dose of propofol, the PCA consumed, was actually significantly lower in the electroacupuncture group when compared with the sham acupuncture group. The acupuncture group also has much lower pain scores and also much higher patient satisfaction score and also endoscopist satisfaction score. And we also went on to perform a multivariate analysis, and we found that among all the other variables, electroacupuncture was associated with much lower doses of consumption of the patient-controlled analgesia. So for this study, we concluded that the use of EA or electroacupuncture is more effective than sham acupuncture in reducing procedure-related pain and the consumption of analgesics during colonoscopy. And the use of electroacupuncture is an independent predictor of less consumption of patient-controlled sedation or analgesia during colonoscopy. So apart from analgesic effect, I think electroacupuncture has been shown by a lot of animal studies to have some effect on GI motilities. Like these two studies, animal studies, actually acupuncture on a certain acupoints is shown to be associated with increase in colonic motility as well as small bowel motility. So with all these background information in mind, the last part of my talk is focusing on the use of acupuncture in laparoscopic colorectal surgery. We know laparoscopic colorectal surgery is good, a lot of benefits, but it's very expensive. And hence, an early recovery and shorter hospital stay, we believe, is highly desirable. But I know we've been using ERAS, for patients undergoing laparoscopic colorectal surgery, but ERAS is complex. To me, it's involving multiple, disciplines, a lot of resources put in. So can we actually have something that is simpler to implement and less labor-intensive than a full-scale ERAS? So the answer may be acupuncture. So we actually hypothesize that because acupuncture can reduce pain and also enhance GI recovery, it may lead to reduced hospital stay. So with all these in mind, we have actually conducted a randomized controlled trial published in Gastroenterology back in 2013. It's a 3-arm study. Altogether, 165 patients were randomized into 3 groups: the acupuncture group, the sham acupuncture group, and the control group. The primary outcome measure of this study is the time to first bowel motion. Secondary outcomes include hospital stay and also pain and also analgesic requirement. Now, for electroacupuncture, a very small principle, you can see these are the 4 acupoints that we use, and they are relevant to the treatment of abdominal pain, abdominal distension, and constipation, according to the traditional Chinese medicine theory. And for the patient randomized to the electroacupuncture group, it was performed by a fully trained and qualified physiotherapist acupuncturist, and each session of the acupuncture lasted for 20 minutes. And the patients underwent 1 session of acupuncture daily from day 1 to day 4 after surgery, or to the time when the primary outcome had occurred, whichever was earlier. So results. Now for this study, we actually used 2 stepwise comparison. In the first comparison, we try to compare those patients undergoing true acupuncture versus control. Now, if we look at a primary outcome measure, the time to first bowel motion was actually significantly shorter in patients receiving acupuncture compared with control. And they had also got a much shorter hospital stay. And if we look at the pain scores and also analgesic requirement also was much lower in patients receiving acupuncture. But this observation can be due to a placebo effect. So that's why we went on to have a second comparison, that is to compare patients undergoing true acupuncture versus sham acupuncture. And again, very similar results were achieved. So shorter time to first bowel motion and also lower pain scores. So this is actually not due to a placebo effect. And we have also went on to perform a multivariate analysis, and again, electroacupuncture was found to be an independent predictor of shorter duration of postoperative alias and also shorter hospital stay. So this study actually suggests that acupuncture is more effective than no acupuncture and sham acupuncture in stimulating early return of bowel function and reducing post-op analgesia requirement. And acupuncture is also more effective than no acupuncture in reducing the duration of hospital stay. And the use of acupuncture is an independent predictor of shorter duration of postoperative alias and hospital stay after lap colorectal surgery. To sum up everything, I would like to give this final concluding remarks. I think based on our studies, electroacupuncture, we've shown that it can effectively reduce pain during colonoscopy and also after laparoscopic colorectal surgery. Electroacupuncture can enhance GI recovery and shorten hospital stay after laparoscopic colorectal surgery. And I believe that electroacupuncture actually combining with ERAS may constitute a novel integrated peri-op strategy, and it may actually have further enhancement of surgical outcomes. So right now, we're actually conducting an ongoing randomized studies incorporating electroacupuncture as a component of ERAS. So with that, I would like to end my presentation. Thank you very much for your attention.
Very cool.